just the facts, ma'am.
David's going to tell us about medical price transparency. So explain what that is and then tell us about it.
Okay. Medical price transparency is something that we do not have in the United States, generally speaking. And that is, for most of us, when we go to the doctor, unlike going to the supermarket or the grocery store or signing on to Amazon or whatever, we know what we're paying for things. When we go to the doctor, we have no earthly idea of how much our insurance is going to pay, whether the insurance is going to cover it or not, and how much our share is. So medical price transparency, put rather simply, is being told in advance what things cost, having an opportunity to price shop those things. Now, there's two pieces to this, and it's a political issue, unfortunately, even though it shouldn't be. Part of this is tied to the Affordable Care Act. Now, it is true that in the early days of the Obama administration, that they did try to do some more work on price transparency in Medicare. Those efforts were not especially successful, just so we're clear on that. But the second part was the Affordable Care Act actually dramatically increased the cost of healthcare in the United States. As I mentioned in a recent Saving America podcast that we developed, that this item about the pre-existing conditions is totally bogus because there's no price control. Without price controls, being guaranteed insurance for pre-existing conditions is meaningless. And so that's what we got out of Obamacare. So what's also happened is, the irony of it is, and in my book we mentioned that, is the Affordable Care Act forced up the cost of insurance and reduced price transparency. And one vivid example of this that I saw that was published by the Cato Institute recently shows that when they forced everyone to include contraceptives in their health insurance plan, which, by the way, I support that. I think that we should make, if it's a prescription medication, it ought to be covered under health insurance. I don't know why it wouldn't be. But in any event, because Obamacare made such a big deal out of covering contraceptives, the cost of oral contraceptives, so-called the pill, dramatically went up after Obamacare was enacted. So it's not the best way to get things done. Now, in turn, the Trump administration, and they're a little late in their deal. I mean, he's almost to the end of his 4-year term, but they have proposed a pretty strong agenda. It's two pieces. They want to require hospitals to provide prices in advance for procedures that you could shop. So if you've got obviously you're going to the emergency room, you're not picking the hospital even. The ambulance takes you to the nearest hospital with an open emergency room bay. But for people that are having planned surgery, which is a large number of things, including having a stent inserted in your arteries, or having a joint replacement or something like that, you certainly should be able to call up different providers and find out what's the impact on your bottom line. Then the second part of it is that for healthcare providers and insurers to provide patients with information about their share of the cost of services. Now, Texas as a state has actually made an effort to do this by saying that if you go, and this was particularly aimed at emergency rooms where people don't have a choice, and so that people cannot be forced to pay incredibly usurious rates to go in to have a procedure done. So there's some controls here in Texas. I think we may see something like that on a national basis. Now, here's the concern. Where Trump is at the moment, they haven't been able to get things through both houses of Congress. If you can't get it through both houses of Congress, you can't get it to the president's desk. Maybe the House will allow a price transparency bill. If Trump does this through executive order, which is what's scheduled right now, then the next administration, if it's not a Trump administration, could go in and simply change it back So it's a very serious issue. Healthcare costs are a very significant part of the gross national product of the United States. They have forced many Americans into bankruptcy, and there does need to be something done about it. Unfortunately, Obamacare, which was falsely advertised as the Affordable Care Act, actually turned into the Unaffordable Care Act. But we do need to do something to make things go better. What's interesting to me is that I have personally experienced a drop in my prescription medical costs over the last year. And I think the competition from this good RX, which is being advertised substantially on television right now, and services like that are actually forcing the cost down.
And we would love to have your comments. So do your research, look for the facts. And if you want to ask Dr. Schein a question, please include it here in the comment section, and we'll be watching those and we'll get those questions to Dr. Schein. Great. Well, this has been a great day, and we'll be announcing our topics for next week. You can watch us live right here on Facebook every Tuesday, 11 a.m. Central, or you can go over to YouTube, watch it there, or to your favorite podcast. So if you have a favorite podcast and you cannot find, or if you cannot find Saving America, then request it. So we're getting on more and more podcast distribution programs every day. And I know we're on iTunes, and I know we're on a few of the others. So if you want it on yours and you don't see it, then feel free to request it, or send us post a question again in the comments, and we'll be happy to make that effort for you. So thanks again. Thanks for joining us here on Saving America with Dr. David Schein, author of The Decline of America. This is the facts about the presidents for the last 100 years and how they dealt with one crisis after another, whether it's economy, whether it's immigration, or a pandemic, as we have, and other presidents have had. So as we approach the final month in this pre-presidential election year, if you're still undecided, which there are a percentage that are still undecided according to the news, then get this book. The facts in this book will help you make your decision for the upcoming president of the United States. So, The Decline of America, the 100 years of leadership failure. So that'll give you a little insight into this book. So have a great week. David, have a great week. We will see you guys back here next Tuesday, 11 a.m. Central. Thank you very much for joining us.
Thank you, Sandy.